Ladies and gentlemen, welcome to sqadia.com. My name is Mohammad Sama, and today we are talking about the posterior wrist and the dorsal aspect of the hand in anatomy. And in this series of lecture, we're going to cover numerous topics, including the bones and joints in the region of the dorsal aspect of the wrist and hand. We're also going to talk about both the extrinsic muscles as well as intrinsic muscles which are acting at the wrist and the hand, especially in context of the dorsal aspect. In the extrinsic muscles, we are going to talk about both the muscles which are acting at the wrist as well as the muscles which are acting at the digits. So the extrinsic muscles which are acting at the wrist include the extensor carpi radialis longus, the extensor carpi radialis brevis, and the extensor carpi ulnaris, in which we're going to talk about the origin, insertion, action, and nerve supply. Similarly, we're also going to talk about the muscles on the dorsal aspect or the posterior aspect of the wrist and hand which act at the digits, including the extensor digiti minimi, extensor indicis, extensor digitorum, extensor pollicis longus, extensor pollicis brevis, and abductor pollicis longus. And we are also going to talk about the origin and insertion of these muscles as well as their action and nerve supply. Moving on, we're going to talk about the intrinsic muscles of the hand on the dorsal aspect, in which we're going to talk about the intrinsic muscles such as the lumbricals and the interossei. We're also going to talk about the connective tissue structures such as the extensor hood, the extensor retinaculum, as well as the anatomic snuff box. At the end, we are going to talk about the blood and nerve supply, specifically talking about the nerve supply on the dorsal aspect of the hand. And then we're also going to talk about the blood supply, which we're going to talk about the princeps pollicis artery, the radialis indicis artery, and the dorsal carpal arc. We're not going to talk about the superficial and the palmar arc because they are actually in the context of the palmar or the ventral aspect of the hand. And that's pretty much the overview of the topics that we're going to cover in this lecture. Stay tuned for more information on this. Thank you very much.